Hi, my name is Kaylee. I'm a second year student at Harvard Medical School, and this is a day in my life.
Right now, I'm doing my principal clinical experience. That means I've completed a year and a half in the classroom, and now I spend the majority of my time working in the hospital directly with patients at my clinical site, Massachusetts General Hospital. The first thing I do each day before leaving for the hospital is checking the patient record for the overnight nursing notes and new labs. This gives me time to think about how I want to approach the day and helps me be more efficient. When I get to MGH, I'm ready to go see my assigned patients. They're all inpatients with a variety of chronic and acute medical concerns. I then write up a plan for each patient, which I present to the attending physician for her approval, and then share with the nurses and case managers. I spend the rest of the morning carrying out the plan, ordering medications, scheduling imaging, and calling consults. Each day, we have a noon conference with the Department of Medicine. There is always food, and I get to see my fellow clerkship students. My afternoons can vary. On some days, I return to the floor and attend patient procedures like seeing interventional radiology place a dialysis catheter. On other days, we have presentations from other medical students on interesting cases. And I always try to make time for fun hospital events like this therapy dog meet and greet. I commute home on the T. It can be tricky on Red Sox game days since I live just a few blocks from Fenway Park. After I get home, I change into gym clothes and do a quick workout. When I finish my workout, I get cleaned up and start studying. I made a cozy study corner in my room to make this feel luxurious. Even though we spend the day in the hospital, it's important to study on my own to cover conditions that I don't get to see. And there's also an exam at the end of each rotation called a shelf exam, so I have to stay on top of this. I decide to have a leftover burrito since I don't have it in me to cook today. After dinner, I sit down to watch the ultimate medical drama while doing crosswords or playing video games. It sounds more like multitasking, but that's the best way for me to unwind after a long day.